Back pain is terrible. You hear people talk about it, but you just don't realize it till it happens to you. It began several years ago with a herniated cervical 6-7. I had a problem with my middle back. I had some trigger points, and then I ended up getting trigger point injections in my mid back, and then all of a sudden that evening I had terrible low back pain.
Joan first came to me about 2 years ago and was referred for continuing neck pain. She had had a neck fusion, did well in that regard, but had some continued complaints. The long stretches of playing her instrument led to some pain, which limited her activities.
It's very limiting. You feel very weak. It can be just overwhelming. I mean, the amount of pain. It makes work difficult. It makes sitting at a computer difficult. I'm a violinist, a professional violinist, and for some reason, sitting in a chair, just holding up this instrument, it affects my back. Sitting in general is more of a problem. If I could get up every day and just walk all day long, I'm better off.
So she had a couple of options initially. One was an epidural injection, and then a second option was the use of what we call medial branch block. The epidurals are for the cervical or neck area and the lower back or lumbar area. It's a location that medication can be placed to reach various nerves and nerve roots.
Dr. Growney thought that cortisone was clearly what we should do. And we did do one shot, and it was miraculous. I mean, I've never had any issues, and that was a couple years ago now. It's not that common to be able to get away with just one shot. Dr. Growney is a wonderful physician. He will talk all your options through with you. Any questions you have, you are welcome to ask. He will answer them. You're dealing with patients that are in a lot of pain. It's great to have a doctor that will listen.